It was just another busy morning for Sarah, a 35-year-old woman with a demanding job and a really long to-do list. As she prepared for her day, she felt a familiar wave of exhaustion, but she assumed it was stress as usual. Something about this tiredness felt different. It refused to go away. Even when she slept well, she started to wonder if something more serious was going on. Little did Sarah know that her body was sending her subtle messages, signs that something was wrong beneath the surface. You see, cancer doesn't always make a grand entrance. Sometimes it sneaks upon you, leaving small clues along the way. But the good news is that if you catch it early, your chances of beating cancer is increased. There are two ways to catch cancer early. The first is by going for regular checkups, and the second way is by picking up on the hidden signs your body might be sending early enough. Since there are more than 100 types of cancers, each with its own unique warning signs, how do you know alarming features to look out for? Do you start learning all the warning signs for each cancer? While this would be the best way to go about it, it's almost impossible to know all that, which is why in this video, I'll first tell you about general warning signs of cancers regardless of the type, and then I'll talk about the 5 most common cancers worldwide and some specific warning signs you should look out for. But before we jump right in, if you haven't already, please subscribe and share this video with someone you care about, because knowing these signs could save their life. Now, back to the clues. The general warning signs of cancers, regardless of the type, include things like a fever that just won't go away no matter how many medications you take, unexplained weight loss, especially if you haven't changed your diet, skin changes like a wound that refuses to heal or a mole that suddenly looks different, losing your appetite for no clear reason, changes in your bowel habits that could be either an increase or decrease in frequency of stooling, blood in your stool or in your urine. Now, let's get specific. Starting with the most common cancer in the world, lung cancer. The scary thing about lung cancer is that it's really sneaky. It often doesn't show up until it's in the later stages, but when it does, you might notice things like a cough that just won't go away, shortness of breath in a person who does not have any respiratory or heart disease, chest pain, hoarseness of your voice, unexplained weight loss. If you've tried to use over-the-counter medications to treat these symptoms and they are not working, that should make you even more suspicious. As you probably already know, the main risk factor for developing lung cancer is cigarette smoking. Next up is breast cancer, the second most common cancer worldwide. And it doesn't just affect women, men can get breast cancer too. So if you notice a lump in your breast or underarm, thickening or swelling of part of your breast, skin irritation or dimpling, redness or flaky skin on the nipple or breast, pain or retraction of the nipple, it's time to take action. The third most common type of cancer in the world is colorectal cancer, which is cancer that affects the large intestine. One of the key features is blood in your stool. But here's the tricky part. The blood can be visible or it might be hidden in a way that you would not be able to see it with your eyes. So you'd need a special test to find out, which is called a fecal occult blood test. Other symptoms include lower abdominal pain, a change in bowel habits, diarrhea, constipation or feeling like you can't completely empty your bowels, abdominal cramps and unexplained weight loss. The fourth on the list is prostate cancer, and unlike breast cancer, prostate cancer only occurs in biological males. The warning signs include trouble urinating or a weak stream, blood in the urine or semen, bone pain, especially in the spine or hips, as prostate cancer cells can spread to the bone and cause pain, unexplained weight loss, and erectile dysfunction. The fifth most common cancer is stomach cancer, and this will be the last I'll be talking about. One of the most important risk factors for stomach cancer is Helicobacter pylori infection, or H. pylori as it is more commonly known. The bacteria multiplies in the layer of the stomach and duodenum, secreting an enzyme that protects them from the stomach acid. Other factors that can cause stomach cancer are smoking and poor diet, and the symptoms may include abdominal pain, nausea and vomiting, loss of appetite, unintentional weight loss, heartburn, and difficulty swallowing if the cancer is near the esophagus. Sarah's story is just one of many, but it serves as a reminder that we all need to pay attention to our bodies. You never know when a small symptom could be your body's way of waving a red flag. So, if something feels off, don't ignore it. Your body might be trying to tell you something important. Thanks for watching, and if you haven't subscribed yet, please do. Don't forget to share with your loved ones and leave a comment. Bye.